What is the action of hydrochlorothiazide? Therapeutic category diuretics. Drug category thiazide diuretic. Pregnancy contraindicated in pregnancy. Lactation contraindicated or not recommended. Indications: hydrochlorothiazide is indicated alone or in combination for the management of edema associated with congestive heart failure, hepatic cirrhosis, nephrotic syndrome, acute glomerulonephritis, chronic renal failure, and corticosteroid and estrogen therapy. Hydrochlorothiazide is also indicated alone or in combination for the management of hypertension. Hydrochlorothiazide use is common but declining in favor of angiotensin converting enzyme inhibitors, that is ACE inhibitors. Many combination products are available containing hydrochlorothiazide and angiotensin converting enzyme inhibitors or angiotensin 2 receptors blockers. Pharmacodynamics: hydrochlorothiazide prevents the reabsorption of sodium and water from the distal convoluted tubule, allowing for the increased elimination of water in the urine. Hydrochlorothiazide has a wide therapeutic window as dosing is individualized and can range from 25 to 100 milligrams. Hydrochlorothiazide should be used with caution in patients with reduced kidney or liver function. Mechanism of action: hydrochlorothiazide is transported from the circulation into epithelial cells of the distal convoluted tubule by the organic anion transporter OAT1, OAT3, and OAT4. From these cells, hydrochlorothiazide is transported to the lumen of the tubule by multi-drug resistance associated protein 4, MRP4. Normally, sodium is reabsorbed into epithelial cells of the distal convoluted tubule and pumped into the basolateral interstitium by the sodium-potassium ATPase, creating a concentration gradient between the epithelial cells and the distal convoluted tubule that promotes the reabsorption. Hydrochlorothiazide acts on the proximal region of the distal convoluted tubule, inhibiting reabsorption by the sodium chloride symporter, also known as solute carrier family 12 member 3 SLC12A3. Inhibition of SLC12A3 reduces the magnitude of the concentration gradient between the epithelial cells and distal convoluted tubule, reducing the reabsorption of water. Hydrochlorothiazide inhibits sodium chloride transport in the distal convoluted tubule. More sodium is then excreted in the kidney with accompanying liquid. Pharmacological effect begin in about 2 hours after an oral dose, peak in 4 hours, and lasts for 6 to 12 hours. Contraindications: anuria, renal decompensation. Precautions: avoid in severe renal disease, gout, diabetes, patients with moderate to high cholesterol concentration. Interactions: beta blockers, ACE inhibitors, neuromuscular blocking agents, oral hypoglycemics, and NSAIDs. Adverse effects: anorexia, epigastric distress. FAQs: frequently asked questions about hydrochlorothiazide. What is the nursing action of hydrochlorothiazide? Monitor signs of fluid, electrolytes, or acid base imbalances, including dizziness, drowsiness, blurred vision, confusion, hypotension, or muscle cramps and weakness. Report excessive or prolonged symptoms to the physician. What is the best time to take hydrochlorothiazide? If you are to take a single dose a day, take it in the morning after breakfast. If you are to take more than one dose a day, take the last dose not later than 6 p.m. unless otherwise directed by your doctor. What are the characteristics of hydrochlorothiazide? A thiazide diuretic, often considered the prototypical member of this class, it reduces the reabsorption of electrolytes from the renal tubules. This results in increased excretion of water and electrolytes, including sodium, potassium, chloride, and magnesium. Why take potassium with hydrochlorothiazide? Most of the commonly used diuretics to treat hypertension, such as chlorthalidone and hydrochlorothiazide, can cause your kidneys to flush out potassium. A low potassium level can cause muscle weakness or an abnormal heartbeat. What should I monitor when taking hydrochlorothiazide? Lab test consideration. Monitor electrolytes, especially potassium, blood glucose, burn, and serum uric acid levels before and periodically throughout course of the therapy. Can I take vitamin D with hydrochlorothiazide? Using hydrochlorothiazide together with cholecalciferol can cause your blood calcium levels to become too high. Contact your doctor if you are experiencing symptoms such as dizziness, drowsiness, weakness, lethargy, headache, nausea, vomiting, or seizures. Which diuretic is kidney friendly? Hydrochlorothiazide. Thiazide diuretic less potent than furosemide but more gentle with nearly 24-hour length of action. Commonly used with the normal or better preserved kidney function, also used to decrease calcium elimination by the kidneys to reduce the risk of forming calcium kidney stones. Can hydrochlorothiazide lower heart rate? All drugs except prazosin reduced heart rate from baseline. Additional small decreases were obtained over time with hydrochlorothiazide and placebo. Disclaimer: Channel Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. Information given here is for informational purposes only. Thank you for watching the video. Please subscribe to my channel Medicine Guide.